Hi, I'm Sydney, and welcome to Shriners Hospitals for Children, Greenville. You and I will soon have something in common. We both will have had a spinal fusion surgery right here at Greenville Shriners Hospital, and we both will have gone on to live happy and active lives. But for now, I'm here with another Sydney, and she's been through a spinal fusion too, along with our Chief of Staff, Dr. Wattenbarger, and our Director of Surgical Services, Mary Peterson. We are here to help you learn what to expect during your upcoming surgical experience.
If you're feeling a little nervous, don't worry, that's normal. We hope this video puts you at ease and answers you and your parents' questions. You'll hear from my fellow spine surgeons later in this video. We want you to know that together we have performed thousands of spine surgeries just like yours.
Now we will walk you through the surgical process from start to finish. At the end of the video, we will provide a recap so you know what to expect each day. Let's get started.
On the morning of your surgery, you will come to the first floor and check in here at the reception desk. It's important that any family or friends over the age of 16 accompanying you know that they will need to show a photo ID in order to enter the hospital with you. Once everyone has received his or her stickered badge, you will be escorted to the pre-op area. The pre-op area is where you'll go prior to your surgery. There, you'll also meet your surgical team. Your nurse will have you take off your jewelry and take out any piercings. Remove glasses or contacts, as well as your socks. You'll also need to be certain you're not wearing any nail polish.
In surgery, we use a special device to measure the oxygen through your fingernail, so this is why we don't want you to wear fingernail polish. Also, on the day of your surgery, your eyelids will be closed while you're asleep, so we don't want you to wear contacts either.
The nurse will now take your blood pressure. The cuff wraps around your arm and fills with air, so it feels quite tight. Now, it's time to change into a hospital gown. For girls who are 10 and older, this is also when you'll be asked to provide a urine sample.
When you're settled in the preoperative area, your surgeon will come by to see you. If there are any other questions, you can ask them now. We also check your back, make sure that nothing's changed with your health since your last visit, and we'll also sign your back. Signing your back is one step in a continuous effort to have a safe procedure.
Before your surgery, you'll also meet someone from the anesthesia team who will be in charge of helping you go to sleep. You'll have an IV put in your arm, either in this room while you're awake, or later in the operating room after you're asleep. You may feel a tiny pinch just for a second, but your parent or other loved one will be there with you. The IV stays in your arm during surgery to give you fluids or medications.
I wasn't really nervous, but I understand if some kids are. But just remember, they're doing their job, so you'll be okay.
Now you're ready to go to the operating room. At this point, your parents or loved ones will head to the surgical waiting area on the second floor near the kid zone. We'll keep your parents or loved ones updated on your surgery's progress, including when you're done, and that you're headed to the recovery room. This is the operating room, where you'll have your surgery. It's very bright so the surgery team can see well. There will even be a special spine operating table designed for your kind of surgery. It's also kind of chilly, but don't worry, we'll cover you with a nice warm blanket.
There were a lot of people in the room, and I was pretty surprised, but it made me more comfortable knowing that they each had their own specific jobs to take care of me.
You'll get a pulse ox on your finger, which tells us how much oxygen is in your blood. It just feels like someone is holding your finger. You'll get several little stickers on your chest. These monitor your heart during surgery. They feel cool and very sticky. Then, your anesthesia team will give you the medicine you need to sleep.
The sleep that you experience during surgery is different than your normal nighttime sleep. You won't feel anything, you can't hear anything, and you can't wake up just at any time. Your anesthesia team will wake you up when your surgery is over.
You'll wake up in the recovery room. You won't remember your surgery, and it may feel like it was just a minute ago that you took your sleep medicine.
When you wake up from surgery, you might have a breathing mask on, or you'll have a tube blowing air into your nose. That's to allow you to breathe as you're waking up from surgery. You'll also find that you'll still have an IV in one of your arms, and then you'll have an arterial line in another arm. The arterial line allows us to monitor your heart rate as you're recovering from surgery.
Also, while you're asleep, the nurse will place a tiny tube in your bladder. This will drain the urine both during surgery and the day after surgery. Both your special IV and the tiny tube will be removed the day after your surgery.
When the recovery nurses feel you are ready, they will roll you in your bed down to the second floor. Once they make sure you are settled in your room, they will invite your parents or loved ones in to see you.
Sometimes after surgery, the medicines that we use for anesthesia will make you feel nauseous or sick to your stomach. That's okay, and your nurses are prepared to help you deal with that. Sometimes these same medicines can make you feel itchy. That's okay, and our nurses have things that can sometimes help you with that, but it's not an allergy. It's just a normal response to these medicines.
If you need it, we'll give you medicine to help you with your nausea and your itching. Once you're feeling a little bit better, you can have some ice chips and then some juice. Later in the day, you will be able to eat more as you begin to feel better. We use a pain scale so you can tell your nurse how you feel. 1 means it doesn't hurt much, and 10 means the pain is overwhelming. We will ask you to show us how you feel, so we know what we need to do to make you feel better. You'll even have a button that will help you manage your own medicine. You'll be the only one who can push this button.
On the morning after surgery, we'll take away the button and begin giving you pain medicine through an IV, with a pill, or with liquid. Remember, this is the toughest day. The more you move, the better you feel, so get up and moving.
The morning after surgery, you will usually be ready to sit up. In most cases, you will sit for an extended period of time. Once in the morning, once in the afternoon, once in the evening. Plus, we will want to have you up and walking as soon and often as possible. How long you stay after your surgery depends on what your doctor feels like is best for you. Most patients stay with us 2 to 3 nights. When it's time to go home, you'll get a first-class wheelchair ride to your car. You will want to have 2 pillows and a blanket waiting for you in your car to make your ride home a bit more comfortable.
When it's time to go home, you'll be given a prescription for narcotic pain medicine. Narcotics, when taken as prescribed, are very safe and help you move better. Remember, the toughest time is behind you. We want you to take your narcotics regularly for the first day or 2, probably every 4 to 6 hours, but again, as prescribed, and then after that, as needed. You can also take over-the-counter ibuprofen or Motrin to help you wean off of the pain medicine. Do not take Tylenol with your prescription.
The medications you receive through your surgery and after will slow your bowels. It seems funny, but we ask you all the time whether you're passing gas or when you're pooping. The nurses will help you have a bowel movement before you leave, and after you go home, it will be important to make sure your bowels keep working.
What I tell my patients to try to remember is APP, activity, increasing your activity every day, trying to do more each week, trying to be more and more active. The 1P is for pain control. We're going to adequately control your pain in a safe manner. And then the 3rd P is poop. You have to poop before you go home, and you have to continue pooping once you get home.
It's natural to be nervous when you're going home, fearful to move, and afraid to do things that you normally do. But we want you to be active. We want you to be moving around. We need you to be moving around. Try to spend as little time as possible lying down, but rather be up with your family, watching TV, playing video games, reading books, anything you want to do in a chair or walking. You're never a shut-in. You're always free to walk around, go outside your home, go to whatever store you want to go briefly. Probably you're not going to feel like going for a long time, but you'll certainly want to go briefly to pick out snacks and things of that nature. So don't feel cooped up, move around, and that'll make you feel better.
Your care manager will call you a few days after your surgery to see how you're doing. In the meantime, make sure to follow all of your doctor's instructions. We hope what we've told you has helped you to feel better informed about what to expect before, during, and immediately after your surgery. Now, we'd like to show you what to expect in the weeks and months to follow.
Remember, everybody's different, so if your recovery is a little slower than the kids that you see in these videos, don't worry, you'll do great.
Doesn't hurt too much. Good.
If we've left any questions unanswered, be sure to ask your care manager or doctor. They'll be happy to help. Thank you for your time and attention.